California could become a sanctuary state for women seeking abortion and other reproductive care. Today, a group of more than 40 abortion providers and advocacy groups released a list of recommendations for the state to consider if the U.S. Supreme Court overturns Roe v. Wade, the decision that forbids states from outlawing abortion for the past 50 years. Joining us now to talk more about this recommendation is Jody Hicks. She is president and CEO of Planned Parenthood Affiliates of California. Jody, glad to have you here. It's a fairly long list with 45 recommendations here in total. What are some of the most important ones you think our state should implement?
Sure, and we'll be doing, you can look forward to hearing from us on progress reports. There's things the state can do immediately, change ways that removes barriers to things like telemedicine and medication abortion, but certainly investments that the state can make in ensuring that barriers to abortion are removed, cost barriers, practical support, people needing travel and childcare, lodging, things like that. When they're seeking care here in California.
I mean, much of these recommendations do come down to money. Obviously, a lot of people who might be seeking this care, they're coming from other states, like you just mentioned, travel, lodging. They might have other children, something like that. How would the state even pay for these types of changes?
So there are private organizations and nonprofit organizations that exist already. We envision public and private partnerships. One of the recommendations is really just putting together information. So there's a centralized place that patients can navigate what is available in terms of resources when they navigate things like travel and seeking care when they live in a state that doesn't provide those. But really, it's just investments in providers, in our infrastructure, and ensuring that we can provide care. I mean, I think it's important that just because a state with extremist politicians pass a ban against a service that is essential, that those patients still won't need and seek services. And if we know, we've already seen what happened in Texas since September 1, in those immediate weeks, we had 2 to 3 patients on average a day that were coming from Texas. So we know the need will be there, and it's important that as a state, we plan and prepare for that.
So you all have already seen several different patients coming over to try and get the care that they need.
Absolutely. Since Texas instituted SB8 and September 1, in those immediate weeks, we saw patients. And it's also important to know that we have already been seeing patients from out of state. So even the year prior to Texas going into effect, we provided over 7,000 visits for people seeking care from out of state because access to abortion has already been an issue. Taking away a fundamental right that is provided under Roe v. Wade will just, make that tens of millions of times worse for patients seeking care. But it's already an issue in many states that there's very few providers that can provide care for abortion services.
I know we talked about the different ways that, the state could potentially help folks when it comes to travel and lodging and that sort of thing. When it comes to insurance, I know that that's a really big, difficult part for a lot of women going through this process, trying to figure out how am I going to pay for this. I know Planned Parenthood does help you set up some sort of way to pay for the process. Obviously, that would then kind of carry over into these cases as well, right?
That's right. And some of the recommendations are addressing insurance head on. So removing cost sharing. If somebody has a $500 deductible and they need a time sensitive service that is something like abortion care, we need to address that. So there's recommendations for people with insurance, for people that that are paying out of pocket and need care in that way. But it's really just ensuring that we're able to see patients. And we also know that when states institute bans like this, it disproportionately affects people with low incomes, people of color, people in rural areas. And so, I mean, I think we know what people are looking at in terms of the influx of patients that will need care and will likely come to California. What we're concerned about is if we don't see that influx of patients, and then we know that patients are just not able to to get to funds that they need in order to seek that care. And that's a big concern and keeps most of us up at night right now.
Well, and a big concern that they might seek care in, unsanitary conditions or in conditions that are not necessarily, up to par in terms of making sure that their health is taken into consideration here. Why was it so necessary to send out this list to state lawmakers right now, this quickly?
Well, we know that they go back into legislative session in January, so we wanted to make sure to have those recommendations in place as people start to put together their legislative package. That was important. We also knew that the Supreme Court was starting arguments and they'll be making a decision in the summer, and we need to spend this legislative session preparing California to be able to treat patients should that decision go in a way that affects half the country. So we wanted to be prepared. I think it's extraordinary that in a 3-month time period, we were able to get over 40 organizations. There was over 150 participants in the last meeting that we had, including policymakers. And so the list of recommendations is really comprehensive, and we're proud of California for doing some unprecedented work in unprecedented times right now.
Definitely. What kind of feedback have you been getting from lawmakers so far?
A lot of interest, and like I said, we had lawmakers that participated, including the president pro tem of the Senate, that participated in the work groups throughout the 3-month time period. And so they were able to hear testimonials from experts and people with real world and life experiences, and learn not just about the problems and the barriers that are in place now, but what potential solutions can be. And so you can expect to see some action from this. We expect to have proposals in the budget. We expect to have a package of bills that will be introduced in the coming months. And we'll be doing, the council will be doing progress reports so that we can see how we're doing here in California as we implement these recommendations.
Well, we know that Planned Parenthood is the largest abortion clinic in the country. Talk to me, do you have a projection, the agency, does it have a projection on the future of abortion and need for it in the future?
I mean, I think we know, one of the things we do know is the devastating impact that happens on people when any kind of barriers to access care, especially abortion, exists. And so we know that if we're not prepared to be able to take care of patients, if we're not prepared to help patients as they need to seek care out of their own state, that there will be a devastating impact, whether it's economically, whether it's to their very health care, risks associated with the state taking control of their decision making and forcing them to make decisions that they wouldn't normally make about their own healthcare and their own lives. So we predict that we have a real big task and important task in front of us, and how we can ensure that we're taking care of people if states are insistent on taking away an essential right to essential health care.
Jody Hicks, President and CEO of Planned Parenthood Affiliates of California, thank you so much for joining us and giving us a little bit more insight on this issue. We appreciate your time.
Thanks for having me.